Hi, I'm Maggie Buckley, and I'm here to talk to you about a lifetime of accessing care and challenges, obstacles, etc. I have no financial disclosures. I should disclose that despite having an Irish name, I am half Hispanic. My mother, Loyola Antoinette Angel y Montaño, it sort of gives you all the information there. I have the privilege of having an Irish name, and I have the privilege of being able to shade myself going outside to avoid some of the obstacles that are presented by other presenters in our sessions and other people that are here. And I want to acknowledge that I am well aware of that privilege. There we go. Oops. What we're going to cover today is what it's like to grow up with hypermobility and the diagnosis early on in life, the challenges of balancing the building blocks of care, the obstacles to care, the hope and solutions, and then I'm going to present an example of comprehensive integrative care specifically for pain management. So my journey began in the 1970s as a 10 and 11-year-old child, having dislocations of the knees, the shoulders, etc. And I was fortunate enough that the orthopedist on call in the emergency room for 3 of those visits recognized something. So he did a full evaluation and eliminated all of the things he could test for. Ultimately, he decided it's Ehlers-Danlos syndrome. He said, don't bother learning the name. Nobody knows what it is. And at the time, they thought it was to affect it. They believed it affected 1 in 750,000 people. Just talk about your loose joints. Talk about your hypermobility. Don't confuse them with the name of this thing. And you're never going to meet anybody else who has this. So at the end of the appointment, he took off his doctor's appointment and he sat on the bench, or his doctor's jacket, sat on the bench next to me, and he said, "Except me, I have this. So I can tell you what it took for me to get to where I am today." So that was the very first gift that he gave me. The second gift that he gave me was sharing some of his lived experience and ways that he learned to cope with hypermobility. And the third tremendous gift that he gave to me was the facilitation and the guidance. He was my quarterback. So first of all was all of the things I needed to do. I needed to be involved in what was going on. I needed to learn to set my limits, to speak up, to ask for help, be willing to try things, be willing to fail, be willing to step up and say, no, I shouldn't be doing that. Acknowledge that pacing was how I was going to get through things. Take notes, try everything, learn everything you can, and bolster that communication skills so you communicate very concisely with healthcare professionals. And he advised me to get a copy of Gray's Anatomy and learn the names of the different body parts so I could be very specific and precise when describing pain or problems. He set up referrals for me to learn the skills that needed. And as he set up those referrals, he'd tell me why he was setting up those referrals. He would also, in the example of the physical therapy referrals, he would put specific instructions for the physical therapist on a body part or a certain group of muscles to work on in there. He got me into a yoga class, which was to build a mind-body connection. Some people say yoga is not appropriate for people with hypermobility. And he said, the objective for you isn't that you want to learn to stretch to your limits. The objective for you is to look around and see what other people, see what their end range is, so that you learn what normal looks like and try and feel what it feels like for you to get to that point. He got me into a meditation study at a university, local university, and he set me up with mental health support. So I was seeing a counselor. The logic being, this is going to be a really tough journey throughout your life. You're going to have to learn how to express yourself and how to vent. You need a safe space to do that, and it will help your communication skills. He also had follow-up appointments with me to monitor my progress, adjust recommendations, talk to other healthcare providers, the pediatrician, and to write more physical therapy orders. Oops. So different methods that I've tried have included acupuncture, massage, Pilates, Feldenkrais, Alexander technique, 1,000 other things to manage pain. Different sports and exercise options, everything from aerobics to yoga and everything in between. He said it was okay for me to try skiing, ski racing, and that, again, I needed to set my limits and figure out what I could do. Assistive devices, I'm not going to go into much detail because Mars will be talking about that later this afternoon, but consider everything from needle nose pliers, household items, to wheelchairs, walkers, etc. They all have a purpose, and they're there to help you. Build a network of people with chronic health conditions, not just with the same diagnosis, because you can learn tips and tricks to cope, and these people are accessing the same healthcare providers, so they're going to be able to refer you to their practitioners, which might help you and give you some creative ideas. So the evolution of my access to healthcare was that as a teenager, I had great access to this wonderful doctor who was managing everything, and I had every specialist available through an HMO. Local universities had research studies. The school had support services for me. As a young adult in the workforce, things were not easily accessible, and I learned that I was very fortunate, unfortunately, to have what I had before, and now I was in a position where I had to build my own team, find my own resources. And it wasn't easy. There were financial considerations, there's geographic issues and insurance coverage limitations and denials. Limitations, for example, on the number of physical therapy appointments you can have in a given year. As a maturing adult, maintaining medical coverage has been a challenge, appealing coverage denials, and age bias. So whereas early on they'd say, well, none of this is going to kill you, now they say, well, there's other things that are going to kill you first. So neither perspective is really helpful. So other obstacles, I'm not going to read everything to you here. Undertreated pain and under-recognized fatigue are where I want to focus, because it's a not well understood condition with multisystemic implications, which you've heard about from speakers already today. And pain is part of every one of those body symptoms. Pain is a part, and fatigue are parts of all of the other comorbidities that go with this. So there are hope, and there is hope, there are solutions, and to everybody here, I would say, listen to those with lived experience. They're going to be the ones that know what's going to work. Envision comprehensive integrative healthcare, similar to what I was provided as a teenager, which was somebody giving me all the options in there. And in your sphere of control, work to facilitate change to support comprehensive integrative healthcare. What I'm talking about when I say comprehensive integrative healthcare, I know this is a busy slide and it's probably difficult to see. The patient is at the center, and then we're looking at, as you expand out in the wheel, the different ways that pain is managed. There's social factors, there's psychological factors, and there's biological factors. And we need to be able to access all of these things. Unfortunately for EDS, the different types of EDS, we're treated with things that are called off-label in this country, meaning it's not designed to specifically treat EDS. It might be designed to treat a specific condition with similar symptoms. So it's something that the doctor's throwing at you to try and make it work. No single thing in the outer ring here, which are just examples, it's not a comprehensive list, is going to fully manage pain or fully manage fatigue. It's usually a combination of things, and the combination of things that works for me is going to be different than the combination of things that works for you. One example of something that I think that's under-acknowledged is acupuncture, for example. So the FDA and CMS in this country have determined that acupuncture is appropriate for low back pain. So therefore, insurance companies will cover a certain number of appointments for acupuncture for low back pain. Well, I have pain everywhere, so it's easy to get that referral, but to actually get the treatment for the other parts of my body, it's not covered. It's not considered successful. There's just no research to support it in this country, despite there being research in other countries that supports that it's appropriate for more symptoms. Medications and pharmacological solutions don't always work for this group, especially for pain. As several people have referred to, the extra ingredients in the medication, not necessarily the active ingredient, often contain the most common allergens that people suffer from. Corn, dairy, wheat, etc. And I'm one of those people who, we don't know if it's an allergy or if it's a mast cell issue, but anything that has dairy, lactose in it doesn't work for me. And all of the drugs that anybody wants to prescribe for me seems to have something in there along those lines. There are also a lot of people with EDS, different types of EDS, who are actually allergic to morphine. Non-steroidal anti-inflammatory drugs, very commonly used. When Motrin first came out, I was prescribed 800 milligrams 4 times a day and was on that dose for more than a decade, which damages your GI system. And we've already got GI challenges in this population. So just because it's the easy thing to do to write the prescription, think twice. Start low, go slow, be very cautious. And hopefully the FDA will start looking at taking things that we're using off-label, encourage research to show the efficacy in this population, and give us more authorization that would be covered by insurance companies because it says, yes, this probably will work in here. I'd also like them to look very closely at the other ingredients, the incipients in there, and possibly eliminate the most common allergens, which seems like a pretty logical thing to do. And I thank you for your time and your attention. And I hope that we can all work together to make some significant changes.